Acute bronchitis is a short-term chest infection caused by inflammation of the trachea and major bronchi. This leads to swollen airways and mucus production. The illness typically starts with a dry cough lasting a few days, followed by a wet, phlegmy cough, sometimes with a sore throat or mild wheeze. It usually resolves within 3 weeks, though about a quarter of people can have a lingering cough beyond that. There are 3 main causes for bronchitis. Most cases are due to viral infections from viruses like influenza or RSV. These are very contagious, spreading through droplets when you cough or sneeze. You can reduce transmission by covering your mouth when coughing, washing your hands regularly, and avoiding close contact with others while unwell. Bacterial bronchitis is less common, but can also be contagious in the same way. Chronic bronchitis is a form of COPD. It's not contagious. It's usually due to smoking or long-term irritation of the airways. Treatment is mainly supportive, focusing on fluids, analgesia, and rest. If you develop symptoms such as high fever, breathlessness, confusion, or chest pain, this could suggest pneumonia, and you should visit your doctor as you may need antibiotics.